Right, good evening, everyone. It's just so nice to be with you all for our final Better Health session. And they've been really good. I've certainly enjoyed sharing with you all and learning with you all as well. And, I do hope that these sessions have been useful to you and that you and I are, making positive changes to our lifestyle and to our mental health and our physical health, emotional health, and our spiritual health as well. So, so this week we're continuing more with our mental health themes and how to boost our mental health, especially during this lockdown time. A lot of people have struggled. Lots of people had struggled, actually. A survey was done of over 1,000 psychiatrists, I think in May last year, and they had commented on how many new cases of mental health problems were presenting to them, and they were quite serious ones as well, including psychosis and mania and all different things. And certainly we can see that mental health problems have really taken a turn for the worst in many people during this time. And obviously when we speak about mental health problems, I'm just using a very broad term, but there is a lot that we can do for ourselves to maximize our mental well-being and actually our overall well-being if we do that. So we're going to be looking this evening about how thinking can promote our mental health and how correct thinking can boost and optimize and maximize our mental health. So we're going to just go straight into it, and this is a shorter presentation. I always say that, and then it ends up being dead long, but it should be quite short. There's not many slides, but one thing that I will say is we're going to do a little exercise. Obviously, you're not compelled to do this exercise, but we're going to do a little exercise at the end. So I suggest if you are able to get a pen and a piece of paper, or to have something where you can just write down. If you want to use your iPad or your phone, that's fine. Just go ahead and collect it, because we are going to need it later on when we do our little exercise at the end of this short talk. So please make sure that you have something to write with and something to write on for the end of this presentation. Now, I did give this talk to a church group about 2 weeks ago, so if you were there, I apologise that you're going to get a repetition of it, but we can all learn by having things repeated to us. So if you are one of those people, I hope this just consolidates what you have actually heard before. So thinking to promote our mental health and our well-being. Okay, so we're looking at thoughts, and really thoughts are very, very, very powerful, and they can have a profound effect on our feelings, a profound effect on our emotions, and a profound effect on our mood, being the state of mind that we are in. So what is the connection between thoughts and feelings? Well, feelings, the way we feel about things, can be a direct result from our internal and external environment. I'm just going to ask if you can mute. That's fabulous, thank you. So our feelings, they result from our internal and external environments, from stimuli from the internal and external environments. And these stimuli are often messages that we give ourselves, certainly in terms of what's going on within us internally. The messages that we give ourselves through our self-talk, these often are the basis of our thoughts and what we're focusing on internally. And these thoughts then directly impact our feelings and our emotions. So thoughts are really key to how our state of mind is, and these thoughts come from, or they're stimulated by, they're derived from the things that we tell ourselves. So our feelings and our thoughts are very, very, very closely bound up. And our emotions impact our mood. And actually, when we think about our mood and we think about what state of mind we're in, whether we're depressed or whether we're elated, whether we're joyful, etc., that state of mind is often more to do with our thoughts, what we're thinking, than actually what events are going on in our lives. Now, I use that term a bit loosely because the events that are going on in our lives could impact your thoughts, which then will impact your mood. But one of the things that we have come to understand is that our thoughts can actually transcend what is actually happening in our lives. And there are many examples about this, but two examples that I can think of really, really, really clearly that spring to my mind are things from the Bible. So I'm not sure how many of you are familiar with the Bible, but in the Bible, there is this account of what happened to two people in the New Testament book of Acts. And basically, there were two apostles, one called Paul and his helper, Silas, and they had actually been arrested and put into prison because they were telling people about Christ. And they'd been beaten and they'd been treated really badly. But actually, instead of being very, very depressed and having a depressed state of mind, they were actually singing in their prison. Actually, their spirits were up. Why? Because their thoughts and what they were focusing on transcended the events of what was going on in their lives. So the way in which they thought about those life events had a direct impact on their mood and on their state of mind. And this is how they were able to be singing when they had actually gone through quite a lot of abuse and torture. So our thoughts, they are powerful. They affect our emotions, they affect our moods, and in fact, they affect who we are as people. And again, this is a concept that is very clear in the Bible, and a famous proverb from the Bible, it says, "For as he thinketh in his heart, so is he." A lot, you've heard the statement, "You are what you eat." Well, this essentially is saying you are what you think. And to just illustrate how powerful thoughts can be, I just want to draw your attention to this study that was done. And it was cited by a Martin Keller of Brown University at quite a prestigious meeting. So this was at the American Psychiatric Association's annual meeting quite a long time ago in 1999, but nevertheless quite important information. So he cited a study wherein they were looking at patients who had suffered from chronic depression for at least 2 years, but many of these patients had been suffering up to 20 years. Now, depression can be a very, very, very debilitating condition. And I think I mentioned a little bit about depression last week in terms of what it looks like and what people go through quite briefly. But these people had been suffering for between 2 and 20 years. And they tried lots of different things. They tried various drug therapies. They probably tried a bit of nutritional therapy, maybe some hydrotherapy, etc. And nothing was helping them. They were still depressed. So basically, in this study, they were split up, and the therapy group, so the group of people who received an intervention, they received an antidepressant, and they also received an intensive regimen of cognitive behavioral analysis psychotherapy. So basically what they received was cognitive behavioral therapy. That is a type of cognitive behavioral analysis psychotherapy. And what that is really is thinking therapy. They basically went through counselling, but they use a specific modality of counselling, which was this cognitive behavioural therapy, to see what effect this would have, along with the antidepressant drug, on their depression. And remember, I said that these people had been suffering for a long time, between 2 and 20 years. And suffice it to say, the results were astounding and outstanding. So the results showed an 85% response rate, which was an improvement in the depression symptoms. And it was thought that this was really due to the thinking therapy, or the cognitive behavioral therapy that these patients were receiving. Why? Because they had received drug therapy in the past, and it did not have such profound positive effect as when they use the two therapies in combination. And so we really feel that most of this improvement was because of the rational thinking therapy. And that just really does go to show that, you know, you can, or I can, any of us, we can be in a rut, we can be in a real rut, and we can suffer very real conditions like depression for years. But things like cognitive behavioral therapy and changing our thoughts can have a massive improvement, and not just help us to feel better, but actually help us to be better. And even if you don't have depression or anxiety or obsessive compulsive disorder, many of us would just have general better well-being if we were able to manage our thoughts in a better way. And so tonight we're going to really look at how we can manage thought distortions. Now, this is just a small aspect of cognitive behavioral therapy. And disclaimer, as you all know, I am a pediatric doctor by trade. I am not a counsellor. I'm not a psychiatrist. I'm not a psychologist either. So we're just going to share a little bit of basic information about what we can do to help our thinking go in the right direction and avoid some mental and emotional distress, which we all go through, even if we do not have a diagnosis of depression or anxiety. So what we do know is that thoughts can be for our advantage. Our thoughts can help our mood and our well-being, or our thoughts can actually cause distress and decreased well-being. And thoughts that cause distress, they often contain gross distortions. Our thoughts can be very, very distorted. And we know that these thoughts are distorted because they are full of irrational ideas. The thing that really motivates this type of thinking is it's quite twisted. The ideas are just false, they are wrong, and they result in a line of thinking which really cause us distress. And so one of the things that we can do to either circumvent or just change that kind of distress that we're experiencing because of our thought is to try to identify the thought distortions that we have, and to reconstruct these thoughts or this thinking pathway on the basis of truth. That's what we need. We need the truth. We need to remove some of this irrational, over stereotypical, over generalized thinking and swap it with more rational thoughts. That's what we need to do, and that's what we all can do. So there's lots of good news, and that's what we are going to do at the end of this short discussion. So what are thought distortions? Like, what do they look like? What do they feel like? What do they sound like? And this list that I am going to give you, and in fact, most of this information, it comes from session 4 from Dr. Neil Nedley's workshops in the program called Depression and Anxiety Recovery. But from that program, we are told that there are at least 10 types of thought distortions. And as you're thinking about these thought distortions, you might actually think of more. So I'm not even going to say that this list is completely exhaustive, but certainly we can certainly glean some information. It's a good starting point. So we're going to look at these 10 types of thought distortions, like what they look like, and we are going to then look at whether we have or whether we demonstrate any of these, which we often do, and how can we reconstruct these things in our minds. So the first one is all or nothing thinking. Now, this type of thinking is very, very black or white. There's no middle ground at all, ever. It is very, very, very fixed. And there are some things which can be very fixed, but some very fixed thinking can also be distorted, and some very fixed thinking can also be delusional, depending on what the thoughts are. So an example of all or nothing thinking is, for example, the young person who has, or it might not be the young person, it could be an older person as well, who's taken an exam, and in this exam they have basically failed that exam, or they didn't get the grade that they wanted. And so now, because I've gone and I've done all this work and I've failed the exam and I haven't got the grade I wanted, so now I am a failure. Because I failed that exam, my whole being, everything about me is a failure. I am a failure, and not just a failure, I am a complete failure. This is an example of all or nothing thinking, because that is very, very, very fixed. And in fact, it is an overgeneralization to say that I'm a failure because I failed one exam. The correct thinking would be, I failed that one exam, not that everything about my life is a failure. That is the first thought distortion. Second one, overgeneralization. When people overgeneralize, and we all do it as well, this often leads to very stereotyped ideas. And a lot of stereotyped ideas or stereotypical thinking can often contain distortions. But the other problem with overgeneralization is that it can often cause severe feelings of rejection. And an example of overgeneralization is this, and I think Dr. Nedley gives this example in his talk. So imagine you have a gentleman, but it could be a lady as well, it doesn't matter. And this guy, he has got his eye on a certain lady and is a bit scared to ask her out. He musters up the courage to actually ask her out, and she says no. So she says no. And he comes away from that quite discouraged, and he feels rejected, which is reasonable. There's nothing wrong with feeling rejected if somebody has said no to you. But then he says, and this is where the overgeneralization comes into it, no one is ever going to like me, and I'm going to be rejected from all women who I try to pursue in any way. That is overgeneralization, because he's gone from being rejected by one person, and now he's taken it to believe that everyone's going to reject him, or all women are going to reject him, or no one's going to like him, or he's never going to have a meaningful romantic relationship in his life. And that is too fixed. He's overgeneralized because he's not considered that maybe that wasn't the person for him. He's not considered that maybe somebody else is interested in him. There's so many different things that he hasn't considered. Why? Because his thoughts are focused on this one line of fixed thinking which cannot change, and really needs to, because all what's going to happen with him continuing to think in that line is he's going to have increased feelings of rejection. And this is where the depressive feelings, the feelings of low self-esteem, worthlessness, all of that can start from that place. And that was just one example, but I'm sure you can think of other areas where distorted thinking occurs because of overgeneralization. So it might be that another type of overgeneralization might be that you've had a bad experience with somebody from a certain culture or from a certain country, or who speaks a certain language. And because you had that bad experience, or even maybe repeated bad experiences with this person, you then overgeneralize that situation and now say that all people from that culture or country or who speak that language are this way. And, you know, then you can see from that, this is how perhaps racist ideas or prejudicial ideas can come into it. They're all examples of overgeneralization, and they can cause distress. And, you know, no two people are exactly the same. So that's something to bear in mind. So that's the second thought distortion, overgeneralization. Third one, mental filter. And a lot of the times when we're talking about thoughts which make us feel distressed, or thoughts which are not good for our mental health or our overall well-being, they're often very, very negative. Now, don't get me wrong, you know, positive thinking is important, but what we need is truth thinking. And not all truth is positive. You know, there is a very clear truth that racism exists in the world. There's nothing positive about it, but it is honest. However, sometimes we over focus on the negative, or we can change things which are actually positive into negative, and this is where it becomes distorted, and this is where it can cause undue, extra and excessive distress. So when we're talking about mental filter, we're really talking about concentrating on negative issues so much that the positive is filtered out completely. It's completely ignored. So, for example, when you look at yourself as a person, or you look at somebody else as a person, you're only focusing on the negative aspects of yourself or that other person, to the point that all the positive is completely filtered out, and you don't even see it. It's as if it doesn't exist. It's like you have a sieve, and all of your attributes are in that sieve. The sieve would be the filter, and that sieve really is I guess a representation of what's going on in your brain. And the holes in that sieve somehow they are big enough to filter out the positive things about yourself and other people, and what is captured is all the negative. That is a mental filter. And when you do that, your focus is going to be only on the negative aspects about yourself or about another person. And you can then see how this can cause distress, really, because all you're thinking about sad things, negative things, distressing things, negatively emotional things, or angry things. These are the things that are what your mind is going to be focused on. And then you can see how this could negatively impact your well-being. And disqualifying the positive, I guess, is the reverse of that. So the fourth thought distortion that we have here is disqualifying the positive. So here you consider positive things about yourself or a situation or other people. You consider that there is something positive, but then you actually disqualify it and make it into a negative. So that is terrible, because you actually had an opportunity to actually cast the mind on something good, casting the mind on something which is real, which is positive, which would actually uplift your feelings, and you made it into something negative. So it can be something really frivolous, like you're wearing, someone says, "Oh, Judith, I like your pink t-shirt." And that is a positive statement. And then I change it to, "Oh no, it's just rubbish, really. It's awful. It makes me look fat," or whatever I want to say. That is disqualifying the positive. That's a frivolous thing. I might not feel too distressed about that, but I might feel distressed if I am focusing only if I'm focusing on my life, and I'm going through one of those those periods where I feel a little bit low and I'm thinking perhaps only about my failures, but I'm not thinking actually about any of the good things or any of the positive things that I've done in my life. And you might be able to resonate with that, or you may know somebody who can resonate with that when you're having a downer about yourself. And that is because you're only thinking about negative things. That would be a mental filter. Or you think about the positive things and then you just kind of cut them down and you say, well, no, that's not really that good. You know, those positive things about myself, they're not, you know, other people are better, or other people can do it better, or yeah, okay, I've done this thing, so what, so what, so what. And this is how we actually disqualify the positive, and we belittle the positive, and we change it into negative, and we can then feel distressed. So that is something that we can certainly do something about. So I'm going to move on a little bit. Thought distortion number 5, and we're talking about types of thought distortions. It's not specific thoughts, but they're just different types of thinking. So we've been general here, but the next type of thought distortion is jumping to conclusions. Now, we all do this. We all do it. Mental health problem or diagnosis or not, we all do this. So jumping to conclusions. An example could be you're walking down the street and somebody who you know kind of walks past, they don't pay you any mind. And what do? We jump to a conclusion. So, oh, that person is just so rude. You know, they didn't say hello to me or didn't pay me any mind because they're this or because they're that, or because they don't like me, or because of something that happened last week or something that's going to happen next week, or whatever the reason is. We jump to a conclusion. And jumping to a conclusion really can take two kind of, it can take two different strands. It can be two ways it can happen. We can jump to a conclusion by doing something called mind reading. So this is you or I thinking that I know what someone else is thinking. So that person doesn't say anything to me because they're thinking this, or that. That is me knowing what's going on in their mind. And I'd just like to remind us that none of us can actually mind read. There is somebody who can do that, and it's not any of us. We may know people quite well. We may have very close relationships with people, and we may know what's going on in their lives, so that we can perhaps make a reasoned guess at what somebody's thinking. That would not be a thought distortion. But actually, in this kind of situation that I'm talking about, just saying, well, they did this because of this, or that, that really is going beyond what is rational. That is really going beyond what we actually have actual facts for. And that is where we jump to a conclusion, and that is where we often will have distorted thinking because of mind reading. And another way of jumping to conclusions, which is equally as bad, is fortune telling, or sometimes it's known as fortune teller error. And this is where we think we know what's going to happen in the future, and we get ourselves really, really worked up, like, I cannot do this because if I do this, then that's definitely going to happen. If I talk to that person, they're going to chop me down. If I go for that job, I'm not going to get an interview. If I speak to that person, I'm going to get rejected. If I try to heal a difficult relationship, they're not going to want to know. Do you see what I mean? We're trying to justify a distorted way of thinking because we believe that we know what the end point or the outcome is going to be, when we don't actually have all of the information and we don't have all the facts. Sometimes we think that way, and it is actually led by fear. And this is a distorted way of thinking, and we need to correct that. I definitely do that, and I definitely need to correct that. Now, somebody said to me today, because I was talking to a colleague of mine about this today, and they were saying, you know, we tend to do that all the time because of things that have happened in the past. And because things have typically happened in the past, we think that they're going to typically happen in the future. And that is true. That may happen. You know, something happens If the same thing happens 10 times because of the same events or the same line of events, it's very likely that it will happen an 11th time. But the distorted thinking is where we believe that there can never be any other possible outcome. That is when it becomes distorted. Or it is distorted when we are trying, when we believe we know what's going to happen in the future and we don't have all of the information and we don't have a lot of past experience with this thing. That also then makes it a distortion because we have no experience or proper information. So that's thought distortion number 5. So we're moving on. There's 5 more to go. Magnification of the negative. It's a little bit like mental filter, but perhaps not as excessive. But it's slightly different. But here is where we blow up simple, everyday negative things completely out of proportion. So somebody looks at you in a certain way. You know, some people will just say, okay, they just looked at me, that's fine. But when we start magnifying, this is where we're thinking, oh, they looked at me that way. Why did they do that? They think they're better than me, blah, blah, blah. This is magnifying something negative, and it's not based on fact. It's not based on rational thinking. It can be based on paranoia, not always, but it can be. And you know, sometimes we have to learn how to fight our battles. You know, somebody steps on your toe, we don't have to magnify that into the worst thing. Oh, they did that because they don't like me. They did that because they're racist, or they did that because of this, that, or the other. Sometimes now they may have done, and we need to consider that, but they may not have done. And have we considered an alternative explanation for us magnifying that small negative thing and making it into a big catastrophe? So magnifying the negative can be very dangerous for us. And so can minimizing the positive. So something really fantastic and wonderful happens, like, you know, your child passes all of their GCSEs. That's a great thing that should be celebrated. But perhaps they didn't get, you know, straight A stars. And so then we go and we minimize the positive, and we make that poor child feel bad, or like they're a failure or whatever, when really we should be celebrating with them. That's just an example, but there's so many other different examples that we can think of. So that's minimization of the positive. So we're getting there slowly but surely. And then I would like to come to emotional reasoning. So I know that I do emotional reasoning, and I have to check myself when this happens. So what is emotional reasoning? Well, emotional reasoning is when our emotions lead us to a certain conclusion that we take as fact. And the evidence for that fact is our emotions. It's not anything more it's not anything more objective than our emotions. So today I'm feeling vexed, I'm annoyed, I'm really, really frustrated for whatever reason. And because I'm vexed and annoyed and frustrated, then that high emotion then gets projected into other situations, and I start making conclusions about the world around me or the people around me. So because I'm feeling mad and annoyed, that person is an annoying person because I'm feeling annoyed. So now that person is annoying. And when you're feeling like that, when you're feeling really emotionally hyped or ramped up there, and you make these conclusions about yourself or about things in the world around you, you really have to ask the question, if I was not feeling like this, would I come to the same conclusion? Would I believe that all of these things or all of these issues are bad? Would I still see things in the same light if my emotions were different, if my feelings right now were different? And because we know that as humans, we often do emotional reasonings, we have to then ask ourselves the question, is it good for me to make this really, really, really important decision while I'm so emotionally hyped at the moment? And actually, is it even good for me to speak or to respond to a person whilst I'm feeling so angry at the moment? Because many times we say things or we do things which we regret when we're feeling very emotional, when we're feeling very, very upset or very angry, or very heated. So emotional reasoning, we've got to kind of question some of the conclusions that we come to when we're at the height of especially negative and distressing emotions. So I hope that makes sense. And finally, the last two, labeling and mislabeling. And again, gotta confess, guilty of this as well. Labeling and mislabeling. So what is that? So really, labeling someone, putting an adjective on somebody, and putting a label, affixing a label to that person. And because you've done that, everything now that that person does, or it could be yourself, you could put that label on yourself, everything that you do or everything that that other person does, is going to be is going to be concluded in the context of the label that you have put on yourself or that other person. So for example, I label somebody as stupid, let's say. I've put that label on them, excuse me for saying so. And so now everything that person does, now I'm going to look at it in the light of the label that I have put on them. So because they're stupid, everything they do now is ridiculous or it's silly because that person is stupid. So even if they do something good, somehow I'm going to think that it wasn't good because they are stupid. They can't do anything good. And it's also like I'm trying to, and if you do that to yourself, you can actually, it can be a basis for creating a self-fulfilling prophecy because, you know, because I have put that label upon myself, and so therefore I am now going to act within the context of that label. So now if I'm stupid, I'm going to go and do perhaps not very sensible things because I've already put that label on myself. Or everything I now do, it's inadequate, or it's not very good, or it's going to be something negative because I am stupid, and so everything I do goes underneath the umbrella of that label or that mislabel. It's a false label. It's not correct because no one is going to behave or live up to that label all the time, every day of their life. They're just not going to do that. No one functions that way, really. So we've got to be careful about the labels that we apply to people. Perhaps it would be more reasonable to say that thing that that person did or that thing that I did was really stupid. It wasn't really very clever for this and that reason. But that doesn't mean that I am stupid. And these are the things that we tell ourselves all the time if we're being real. Some people do it more than others, and some people are more distressed than others because of the labels that they're placing on themselves or the labels that they are placing on other people. And what can happen then is because you put this label on somebody, the label may have gone on that person because you were emotionally reasoning at that time. So for example, if I'm feeling very overwhelmed, that is quite a high emotion. It's quite a difficult way of feeling. If I'm feeling very, very, very overwhelmed by something, that may then cause me to feel quite insecure. And because I'm feeling very insecure, then I could have the emotional reasoning of feeling that because I'm overwhelmed, there is no answer. There is no answer to my problem. That is going to cause me distress. But because also I'm overwhelmed, I will then go and mislabel, and I will say I am insecure, I'm stupid, I'm weak, I'm a failure, and the list can go on and on and on and on. And if we don't take care, these types of thinking can actually lead us into a state of anxiety, nervousness, depression, etc. So that's emotional reasoning and labeling stroke mislabeling. And finally, personalization. I hope this is helping, and I hope I'm not saying things that don't make sense. I'm hoping that it's helpful, but obviously in our question time you can ask me, and I can hopefully clarify any points that need to be. But personalization, this distortion is where everything is my fault. So all negative things that happen is because it's my fault. Okay, so I remember Dr. Nedley giving an example, because he sees patients in his clinic and in various different places, and there was a person who was quite unwell, and they were going to be able to help their health by stopping smoking, like really help themselves by stopping smoking. So they put a plan together, and it was just supposed to happen, and this person was supposed to improve through whatever through the plan to stop smoking. And so that was what was supposed to happen. And then he saw the patient again, and this patient continued to smoke. And he had a thought distortion because he took the blame on himself because this patient had not given up smoking, whereas the responsibility for that person giving up smoking was with the patient. The doctor had done what they were supposed to do, which was to give the health information and the encouragement and the signposting, etc., to empower that person to stop smoking. But the book really stopped with the patient. And you might be in a situation where perhaps you are bringing up children, and they may not be achieving in their life the way that you would like them to, and you're taking that responsibility on yourself. They may not be walking in the path that you want them to be walking in, and you are kind of blaming yourself, saying, well, it's all my fault if I hadn't done this, and if I hadn't done that, and if I hadn't done that. And don't get me wrong, there are certainly lots of things that parents do and can do which can massively influence their children. But once their child gets to a certain age, really they have to take responsibility for themselves. And although the parent, may have contributed to the negative path that the child has taken, there has to be an onus to self. There has to be some personal responsibility, and you cannot take on that blame all yourself. And there could be many other different instances that you can think of where you are blaming yourself for a problem. Something might be going wrong in your marriage, and maybe you are the person mainly to blame for it, but maybe the two people have gone wrong there. Perhaps it could be many other different interpersonal relationships or many other situations, and you're taking on all that blame. But actually, if you were to analyze the facts, then all the blame is not yours. And when we take on excessive amounts of blame, what happens is we feel excessively guilty. And this is where those negative emotions and where the low mood can then creep in, because we're carrying excessive guilt, and it's misplaced guilt. And I think we have to know the difference between what am I actually guilty for, what is my responsibility, and what is somebody else's responsibility. So that is personalization. So I hope that kind of makes sense. So just going back to the types of thought distortions: all or nothing thinking, overgeneralization, mental filter. This is where we completely ignore the positive and only focus on the negative, disqualifying the positive, where we look at the positive and we turn it into a negative, jump into conclusions from mind reading or fortune telling error, but they're both errors, they're both distorted. Then magnifying the negative, really blowing out of proportion everyday negative things which are small into massive catastrophes, which we don't need to do, minimizing things which are actually really great and positive things. This also makes us feel distressed. Emotional reasoning, labeling and mislabeling, and finally personalization. So these are 10 types of thought distortion. And as I talk about it, it all seems quite bleak and quite sad, but there is hope. There is hope, because we can break the mold of this kind of thinking. And essentially what we're doing is we are actually, number one, identifying that there is distortion in our thinking. That's the first thing. And then the second thing that we're trying to do is we're trying to reconstruct our thoughts now on the basis of truth. And in order for us to reconstruct our thinking on the basis of truth, we have to find the truth. We have to look at our thoughts, recognize that there is a distortion there, and find the truth. Once we have the truth, then we can change the way in which we're thinking, and we can change our mood, we can change our emotions, and we can change our feelings. And this really does work, because scientists have found actually that cognitive behavioral therapy, thinking therapy, it actually changes brain biochemistry. It changes neural pathways in your brain, in my mind and yours. We can feel better through thinking in more healthier ways, because we're actually changing brain biochemistry, and that is massive, really, and it doesn't cost anything. It doesn't really have any physical side effects. It may have a few mental and emotional side effects once we try to seek the truth, but it has no physical side effects. And so we have found that this kind of therapy really to be beneficial, and it continues to be used throughout the decades from when it was first founded. So how can we break the mold? We can seek the truth. So our thoughts, what we don't want to do is we don't want to be in a position where we just let our minds wander. And I do that so much. And what we have to do is we have to rein in our thoughts, and we have to think about our thoughts, but actually we have to analyze the thoughts. And we have to, and don't get me wrong, I'm not talking about just simple, normal thoughts like, is this a blue pen? Yes, it's a blue pen. You don't need to analyze that. That is based on fact. But some of the distressing thoughts that you have, that you know that this type of thinking is making you feel sad, is making you feel distressed, it's making you feel guilty, it's making you feel worthless. Those type of thoughts, they need to be challenged, and you need to look for whether there's any possible distortions in your thinking, because that thinking and that self-talk, which is making you feel distressed, is probably distorted. And this is why you have to check. So how are we going to check? Well, you have to ask yourself the question, because remember, we're trying to find the truth. If we find the truth, we can challenge the distortion, and we can break that kind of thinking. So you have to challenge the thought, and you have to ask yourself the question, what fact am I basing this thinking on? So the belief that this person is an idiot because I've put that label on them, or I'm an idiot because I've put that label on me, what fact am I basing that on? Are there any facts? Is there any evidence to show that I am this, or that person is this? And is there evidence, strong evidence, or is it very weak evidence? Do only I think that, or is that generalized way of thinking? And actually, are there any arguments to contest the way I'm thinking? Are there any arguments that are sensible arguments which do not go in favor to the way that I am thinking now? You have to ask yourself that question. Oh, if I go for that job interview, I'm definitely not going to get the job because I'm rubbish. Okay, well, is there an argument against that? Could you think to yourself, well, I might get the job because I've got this qualification, I've had this experience, I know these people, etc. Can anything contest the way I'm thinking now? Ask yourself the question, especially if we're having deep anxiety about something, ask yourself the question, what is the worst thing that could actually happen to me if the thing that I'm fearing so much were to actually come to pass? What is the worst thing could happen? If I go and speak to that person that I'm a bit scared of, if I go and do that presentation in front of a large audience of people and I'm anxious about that situation, or if I go and see the doctor about that lump that is in my breast or that is in my testicle, let's say, what is the worst thing that could happen? Because a lot of anxiety stops us from doing things but causes distress. And in those situations, you have to ask, well, what is the worst thing that could happen? Yes, I could have cancer, but if I have cancer, at least it would be diagnosed and we can deal with it. Whereas if I just leave it, what's the worst thing that could happen then? Could die unexpectedly, leaving behind perhaps a family or a job or whatever else, you know. What is the worst thing that could happen? And then you can ask yourself this question as well. Could the facts that I have, so we might have some facts about the, you know, which support the way I'm thinking. So the fact could be, well, it could be a situation like, well, if I go and talk to that person, they might reject me. They might reject me. But actually, could it be explained another way? Could it be that actually that person is just having a bad time? Is there anything going on in that other person's life? Are there any things that, is there any information that I don't have which would give me a better and a clearer picture about what is actually happening? Can I explain things in another way? Ask yourself that question when you're thinking about something that's distressing to you. Is there an alternative or less painful explanation? Does that exist? And then for those of you who perhaps are familiar with the scriptures, with the Bible, or are there any scriptures? Is there any absolute truth that backs up my position? Or actually, does the scripture go against my position and what I'm thinking? Think to yourself, if my best friend told me this same thing that I'm thinking, what would I say to her or him? Would I think that they're being rational, or would I think that they're being irrational? Would I think that they're being too fixed? Would I say that they're being too overgeneralized? Would I say they're being too hard on themselves? And if I can apply that to other people, why not then apply it to myself? So ask yourself, what would I say if my friend told me the same thing that I'm thinking? What would I say to them? Would my position be different? Again, what evidence do we have for that position or that way of thinking? And finally, what has God said in his word? Is there absolute truth? Is there absolute truth out there which I need to tap into to help me to come to the right conclusion? So these are questions that you can ask yourself when you're having that very distressing thought, to see if the thing that you're thinking is actually true, or whether it's only true some of the time, or whether it's true all of the time, and to see whether what I'm thinking perhaps is distorted rather than truth. But we can break the mold, and that is good news. That is good news. And this type of questioning our thoughts, it's often used, it's widely used in people who have depression, people who have obsessive compulsive disorder, people who have anxiety related disorders, people who've had post-traumatic stress disorder. Cognitive behavioral therapy is used in all of these things, and it's found to be very, very effective. And what we're going to do is we're going to now, this is when you're going to need your piece of paper and your pen or your iPad or whatever you're going to write in. But right now, we are going to do some cognitive behavioral therapy on ourselves. So we've talked a little bit about how are we going to find the truth. But once we've found the truth, we need to reconstruct our thoughts on the basis of that truth. Otherwise, this whole exercise was completely pointless. And there is an acronym. I like acronyms. You've probably understood that. I like acronyms, especially New Start. But now we're looking at this other acronym called HARP. And this acronym called HARP really is about, it's really about truth therapy. It's about changing your thoughts and telling yourself the truth so that your thinking can be less distorted, so that my thinking can be less distorted, so that we can be less distressed and that we can actually be uplifted. So the harp, this is an exercise which we're going to do just now. So the harp, the H in harp stands for hear. So H is for hear. And we need to hear our internal dialogue. What is my self-thought talk and what is your thoughts? And is this thought very distressing? So you just need to hear it. So I want you to think about a thought that's a bit distressing to you. Just hear it. And then we're going to go from recognizing that we have distressing thoughts, but and what those thoughts are, what the self-talk is that is causing us this distress. And the next thing that we're going to do is we're going to actually analyze that thought. So right now I want you to analyze that thought. And the way in which you're going to analyze that thought is you are going to look to see if there are any distortions in that thinking. So the thought that you're having, that you've just thought about, that you've just sort of heard in your mind, that you're telling yourself all the time, or you're thinking about, or you're ruminating on, is that thought all or nothing? Is it very fixed? Is it black and white? Have you overgeneralized? Have you stereotyped a bit too far in this way of thinking that's causing you distress? Have you applied a mental filter where you have concentrated on the negative so much that the positive aspect of the thing, whatever's called, you know, that the thing is, you just cannot see the positive, even though there are positive, but you filtered them out. And I just want you to write down, I want you to write down what thought distortions have applied, that you can apply, that you know happen during this way of thinking that you have, which is causing distress. I hope that makes sense. So I want you to think about and write down, just write down what the thought distortion is. You don't have to write down every fact about it. Just write down, okay, I'm thinking this thing, I'm telling myself this thing, and definitely there's a mental filter there because I've just concentrated on the negative, or definitely I've overgeneralized, or definitely I've disqualified the positive, or I've jumped to a conclusion, or I have blown something completely out of proportion. I've magnified the negative so much that I've blown it out of proportion. Or I've used emotional reasoning. Actually, that person isn't so bad. I just thought they were because I was vexed at the time, or because I was feeling very sad and overwhelmed at the time. Has my thinking become directed by emotional reasoning? Is it distorted because of that? Or have you applied or misapplied a label? Or have you blamed yourself for things that you are not responsible for? So I want you to just think about it for a moment and write it down. So just to go back, think about what you're telling yourself. What is making you distressed? Then analyze. So A is for analyze. Are there any of these thought distortions in that thinking? So I'm just going to give you a moment to just write it down. I'm hoping that you've already written it down. I did this exercise with some people a couple of weeks ago, and one person started to tell me that, oh, there's probably about 4 or 5 thought distortions that I can identify in the way in which I'm thinking about something. So those are the thought distortions. So just going back to our acronym. So you've heard your internal dialogue and you've analysed that thought to look for thought distortions. And now you're going to ask yourself the questions. What facts am I basing this thinking on? What evidence do I have? What is the worst thing that could happen? Can I explain the facts another way? Is there an alternative, less painful explanation? What has God said in his words? What would I say to somebody if they told me this thing that I'm thinking? Have I had any experience that demonstrates that this way of thinking is not true all of the time? So I want you to now look for truth. ask yourself these questions and look for truth, because you recognize that there is some distortion in what you're thinking. Now look for truth. And what I want you to do now, what you're asking yourself these questions, is I want you to move on to the R. And R is reconstruct that thought. Reconstruct that thought on the basis of truth. And that may look like, I am not a failure. I'm not a failure. I did fail that exam, or I did fail my driving test twice, but I am not a failure. I failed at that particular thing, but with the right training, with the right experience, with the right practice, with the right motivation, I can pass this thing with the right help. And even if I never pass it, it doesn't mean that I am a failure. It just means that I'm not going to be able to pass my driving test. It doesn't mean everything about me is a failure. That would be reconstructing the distorted thinking of, I'm a complete failure because I failed my driving test 4 times, let's just say. So I want you to just spend a moment now and write down the reconstructed thought. Write it down. And you know, we are not very good at this as people. Rational thinking has got to be practiced. It's a learned thing. We don't automatically come out thinking rationally and thinking on the basis of facts and evidence and thinking in objective ways. We're very subjective, and if we're feeling emotional or we're feeling distressed or depressed, then it's even harder to do. But what we learned about last week is that we have to be kind to our frontal lobes, and we've got to maximize the health of our frontal lobes so that we can engage in this kind of thinking in a better way. And as we do it more often, just like muscles, if we exercise a muscle, it becomes big and it becomes stronger and it becomes better at the task that that muscle has got to do. And it's the same with your frontal lobe. If you start to think in this way and practice rational, reasoned thinking, as time goes on, you'll get better and better at it, and I'll get better and better at it. And hopefully we'll have more control of our emotions and we'll feel happier because we're thinking in the right way and we're thinking on the basis of truth. So we've heard our internal dialogue, which is kind of distressing and make us not feeling very good. We've analyzed the thought to look for distortions, and we've identified the distortions that are present. And now we've done the R, which stands for reconstruct. We are reconstructing our thoughts on the basis of truth. And we have found that truth because we've challenged the first distressing thought. We've challenged it. We've asked questions to actually see if that is true or not, and to actually find the truth. And sometimes you might find it difficult to find the truth. And if you're finding it difficult to find the truth, then sometimes it's just good to put a pin in it and leave it and come back to it later. Eventually you'll find the truth. And if you never find the truth, then just accept that I have not found the truth. You'll probably feel better that you've accepted the fact, and then you can move on with the rest of your life. So you've reconstructed the thought, and finally you want to practice, practice, practice. The P is practice, practice, practice. The more that you and I practice rational thinking, the better we'll become at it, is what I said before. And hopefully the better and the more uplifted we shall feel. So we've spoken about how powerful our thoughts are. And we understand that our thoughts affect our emotions. They direct our emotions, really. And those emotions really can direct the sway of our moods. However, our thoughts can transcend what is going on around us, and we can use that in a positive way, so that even if some of our life events may be very, very, very bleak, we can try to think about things either in a more positive way or at least in an honest way to minimize our distress and make the tenor of our emotions and our moods be in a better place. And finally, we can maximize our mental well-being by identifying and reconstructing our distorted thinking, reconstructing that distorted thinking on the basis of truth. And so finally, because you know I always like to leave you with some spiritual counseling or spiritual counsel. So these are two texts that you can find in the New Testament of the Bible. And the first one is from Romans chapter 12 and verse 2. And it says, be ye, or be you, if you like, transformed by the renewing of your mind. You can change yourself. I can change myself. I can change the way in which I'm thinking. And you can change the way in which you're thinking, which can change your whole mood, which can uplift your whole mental well-being by changing the things that are going on in your mind, by renewing your mind, and by me renewing my mind with the correct type of thinking. And in this case, we're talking about removing distortions. And finally, to focus on the good. You know, sometimes we can put our minds on things which is just negative always. Sometimes when I think about some of the soap operas that I used to watch, it was just negative always. There was nothing positive, nothing that would make you smile. Just stuff that would make you feel quite bad. And if it was happening to you in real life, you probably would be really, really distressed. But the Bible is saying, you know what, give yourself a break and think about the good. Do yourself a favor and think about the good. So in Philippians chapter 4 and verse 8, it says, finally, brethren, so that's finally brothers and sisters, if you like, whatsoever things are true, whatsoever things are honest, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, whatsoever things are of a good report, if there is anything virtuous, and if there be any praise, think on these things. So I'm hoping that you will take the time, and that I will take the time also, to think about these things which are true, honest, just, that means correct and right, things which are pure, things which are lovely, things which have a good story behind them, and virtuous things, things that are praiseworthy, things that are uplifted. And I'm sure as you think about those things, and as I think about those things, we will all enjoy better mental health and well-being. Thank you so much for listening, and I hope this has been helpful to you.
Okay, once again, I can't say this enough. I've said it every time we have presented these sessions. Thank you so much, Judith, for again another really inspiring session, one with so much information, so much encouragement for us all. I'm sure I'm joined by everybody on the call here, and also the subsequent weeks, for the input that Judith has put into this program. It's been really inspiring to know that we can change our mindsets. You know, when I was coming up, they used to use this term, and they'd say, is it a positive mental attitude? You should have a positive mental attitude. Well, tonight, hopefully that wasn't just a statement. We've been able to break down what that actually looks like. And certainly the whole process of being able to say, this is how my mind is going. These are some of the things that are distorting my mind. And hold on, I don't need to continue down that path. I think that's certainly one of the things that I've took from this, is that we don't need to keep tumbling down that bad path, or that unhelpful path, shall we say. We can stop, and we can rechannel our minds, and hopefully encourage positive mental health as a result of that. So wonderful, wonderful. Right, time is running against us. We want to leave a couple of minutes for questions. This actually, as we said at the beginning of the session, unfortunately for some, maybe fortunately for others, unfortunately for some, this is the end of the current Better Health series. So we've been running this Better Health series now, I think, for 7 sessions. So this is the final one of this series. However, we do want to inform you about some additional things that we will be doing. But before we do that, we want to continue our normal tradition of offering a prize to 2 two very blessed individuals, and actually we're going to go to 3 individuals this week. And the reason for that is one of our winners for last week, Adwoba, he's actually not here in the UK. He's on the wonderful continent of Africa. So because of the challenge of us logistically getting the present there, we are going to reallocate that present from last week. So I'm just looking at names that were here last week. Is Charlene still on the line? Is Charlene on the line?
Yes, I am.
Hi, Charlene. How are you?
Fine, thank you.
Good. I need to check this because I've kind of lost count a little bit. Have you won one of our prizes before?
Yes, I did.
Okay.
The fruit basket, lovely it was.
Okay, you had a basket of fruit.
Yes.
So, okay then. Okay, well, I have lost a bit of count. So if you wouldn't mind, we may offer this. We're going to offer this to somebody else. So I can see another name.
Yeah, that's fine.
Thank you. I can see another name that I've seen a few times. Is it TKD? Is TKD still on the line?
Yeah, I'm here.
Hello, TKD. How are you?
Yeah, good, thanks.
Good, good. Have you won a prize with us before?
No, I haven't.
Brilliant, fantastic. Okay, so you are going to be the winner of last week's prize, if that's okay with you. And it was a massaging, it was a hand massaging tool. And what else was it, Sister Judith? It was
a classical music CD.
That's the one. That's the one.
Handel's Messiah. So because we do know that. So last week, I'm not sure if you were here last week, but we looked at things that we can do in our lifestyle to maximize and optimize our mental health. So we do know that classical music therapy is something that we can do to stimulate our frontal lobe and actually give us better mental health and mental functioning. So you're going to get that CD. And if you write your thoughts down as you're listening to the CD, if you write down things that you're thankful for, if you write down things like what you would, how you would like your life to go in the future, things that you want to change, if you write that in a journal or on a piece of paper as you're listening to the classical music, then this becomes music therapy, and it's really uplifting and it's good for your frontal lobe. And also, the massage roller is because we know that massage is hugely relaxing, so you can use that on your any tension parts on your neck or your back, or you get someone else to do it. You can use it anywhere, and it's just fab.
Excellent.
Okay, thanks.
Fantastic. Thank you. So, TKD, if you could just message me, if you just send me a message in the chat, if you're okay using the chat box, either giving me your full address or your phone number at least, and I can get in contact with you and we can get that out to you. So if you just message me before the end of the session, that would be great.
Yeah,
right. So our
thanks.
winners for this evening, I've picked 2 more names out. So we have Mandy. Is Mandy still on the line? And also, is it Anay? Mandy and Anay, if you're still, I can see Mandy's name on there.
Yeah, thank you.
Hi, Mandy, how are you?
I'm good, thank you.
Good, okay. Well, I'm sure I haven't seen your name win a prize, but have you won a prize with us before?
No, I've only actually been on a couple of these meetings. I'm a friend of Dave Miller's, so I've joined in on these on specific ones that I'm interested in.
Okay, fantastic. Well, warm welcome to you, and I'm gonna say that you are a winner for us this evening. And is it Anay? Have I pronounced that correctly? Anay? Hello? Anay may have gone. Okay, well, we're going to give another one to Cecil. If Anay has gone off, Cecil, I can see the name Cecil. Cecil, are you still with us? Possibly in the background. Well, let me show you the award first of all. So this week's session, we're going to be having this week's winners will be winning, first of all, this wonderful prize. So it's 2 books, the first of which is called Telling Yourself the Truth. So not listening to the negative thoughts, not listening to the negative actions that might be in our mind. So the first book is called Telling Yourself the Truth, Finding Your Way Out of Depression, Anxiety, Fear, Anger, and Other Common Problems. So that was the first prize that will be won. And the second one, let me get this right. okay, is this one. If you can all see that, it's SOS. Can you see that one?
No.
It's still on telling yourself the truth.
Okay. Okay, does that come up now? You see that one? SOS, Help for Emotions. Okay, so we have 2 books that will be going out. So for those who have won those, so Mandy, Cecil, if you're still on the line, if you could drop us a line with your contact details, and then we'll be able to get those out to you. Also, TKD, if you could do the same. Right, moving on very quickly, we're going to run over by about 5 minutes or so because we want to give you an opportunity to ask questions of Dr. Judith if you have any. But we also wanted to tell you about a couple more things that are coming up. As of next Thursday, we've said that this is the end of our actual Better Health presentations for the moment. But we are going to go through a series of exercise classes. Now, these exercise classes are going to be completely free of charge. They will be running from 7 o'clock every Thursday throughout the whole of April and throughout the whole of May. Okay, so if you remember a few weeks ago, we were talking about the benefits of exercise and how this can help us both physically and mentally. So we're going to be teaming up. For those of you who remember, we had someone who came on, his name was Leon, and we did a session. We did a 15-minute session, which some enjoyed. So we're going to be having these exercise sessions. The first half an hour will be, let me see if I can get the poster up. Can you see that at all? Does that come on the screen?
Yeah.
Excellent. So the first half an hour of the session, we're saying it will be for beginners. It will be for people who maybe want to use it as a warm-up, people who are just kind of maybe getting back into exercise after a long period of time, or people who are maybe new to exercise or they haven't exercised for a good while. So the first half an hour will be those beginner sessions. So we'll be using chairs, we'll be doing exercise that you can do sitting down. But also, if you want to join us for the second half of the session, which will start at 7:30, that's more an intermediate class. So maybe it's for people who want to push themselves just a little bit more. It's not going to be super frantic, but it will be a good workout that I'm sure we're all going to benefit from mentally. That's you as well, Judith, mentally as well as physically. So join us from next week for 9 weeks, completely free of charge. You'll be using the same number that you're using at the moment, same password as health. So from 7 o'clock, beginners to intermediary, and then 7:30, intermediary to advanced. We're suggesting that you can use your camera on or off, whatever you feel comfortable doing. It's good to share, and you know, it's fun when you're seeing other people struggling as well. Enjoying themselves as well. So if you want to put your camera on, we would encourage that. But if you want to leave your cameras off, that's perfectly fine as well. So that will be taking place from next Thursday throughout the whole of April and the whole of May. Okay, right, last thing. We are also going to be running another series. And has that come on the screen again? Okay. Okay. Now, this is a series that we've been running on another night a week, which is called Let's Talk About. And as Inspired Steps, we've just been providing opportunities for people to talk about a variety of topics. So we've done football, we've done dogs, we've done a number of different things. But for a period of 6 weeks, starting next Wednesday, we're going to be running through a series alongside a new network, which is called the Bereavement Network. And as the poster suggests, this is a network that's going to be providing an opportunities for individuals to either talk or to listen to others who are sharing their experiences of living with bereavement. Now, this might be bereavement as a result of the last 12 months that we've all gone through, but it may be bereavement that has happened many years ago that people are still working their way through and want to share with others or to hear from others their experience. So this will start from next Wednesday. I'm going to put back on the screen because it's a different Zoom ID. Okay, so these are the 6 weeks. The first week, next Wednesday, the 31st, is the initial meeting People will be describing what will be taking place. There will be some contributions every week from people who have experienced bereavement and how they have coped with that and are still coping with that. So that's the first week. The second week then is going to be looking at, as it says, shock and denial, those first instincts that kick in, those first feelings that kick in. How do we deal with shock and denial? Then moving on to anger, which can often come in, and how we're bargaining with what we're feeling. The 21st of April is going to be talking about depression. The 28th of April about acceptance and hope. And then finally, the 6th week, the Wednesday, the 5th of May, is going to be about finding meaning. Okay, so if you would like to take the Zoom ID, these details will also be on our website, which is inspiredsteps.co.uk, and our Facebook page. So we'll be uploading these details onto our website and Facebook page. The Zoom ID 849-4253-7111, and you just need to use the password TALK. Okay, so maybe we can put that in the chat, and I'll just confirm the time. Okay, so starting on Wednesdays, the room will be open from 7:30 and the session will run from till 8:45. So from next Wednesday, 7:30 start to 8:45 p.m. Okay, so just a few announcements. One more thing I would ask is that I'm going to put our mobile telephone number and also our email address in the chat box. What we would love to hear from you is, one, any comments about how you felt about this Better Health series. Has it been useful? Has it been helpful to you? Are there things that you would like to take forward? Are there things that you think we may have been able to do better? And we would also like to hear from you about other things you would like us to perhaps present in the future, other health topics, or any other things that you might be thinking, you know, I'd really like to hear a presentation on that, or I'd like you to expand on something else. So I'm going to be putting our details in the chat. We'd love to hear from you via text, via WhatsApp, or via email, and that will help us to formulate our thinking for the future. So we've got a couple of minutes. I know we've run over, but we're just giving an extra couple of minutes this evening. Does anybody have any particular comments on this week's session? Anything they'd like to ask Dr. Judith about these past two sessions regarding mental health and well-being? Any comments, questions, or observations?
May I please say something?
Of course you can, yes.
I know you've given us the opportunity to do it via the phone or whatever, but I came in a bit late today. But may I just say, please, that, you know, you all are so professional. You know, these, you know, it was quite profound. All the sessions were very, very, very good. And thanks to Dr. Judith and you and all of your colleagues there, Lord, especially these two sessions that Dr. Judith ran there as well. It's been quite very, very much a good professional, you know, presentation. Thank you so much.
Thank you very much for that, Charlene. We're really appreciative of those comments. Nobody, and I know that Judith will say this herself, none of us know everything, but we're just trying to present as much information as we have, and so that we can all learn together and hopefully not just learn, but to apply what we're learning. But we really do appreciate those comments. That's really good of you to say.
Very high standard, very high standard, you know, very high standard presentations.
Excellent. Thank you. Thank you very much. Well, I can't take any credit for that. I'm just here jabbering on. But for Judith and the other doctors and presenters who have put so much effort into this, yes, we do really thank them. So thank you for that. Are there any other comments or questions?
I'd just like to say thank you to Charlene for your kind comments, and also if you feel that any of these presentations could help anyone else, then they are available for you to watch again on YouTube. I think Gary will put in the chat how you can find them on YouTube. All the presentations from Better Health 1 through to these 8 presentations that have been delivered on Better Health 2, and including obviously these final 2 that we've had on mental health issues. So so yeah, you can go ahead and look at them again, or just share with anyone who you think can benefit. But thank you so much for coming on, and thank you so much for your very kind comments.
Thank you.
Okay, just a minute or two. Are there any other comments or observations?
So so Cecil, you look like you're still on here, and I'm going to go and ask you to unmute yourself, because I think you have won these 2 books as well as Mandy. Yeah. So these are the 2 books. Excellent books. I have them myself, and these are used in Dr. Nedley's depression recovery program. You don't need to have depression. These books basically just focus on what we've been talking about tonight in more details. They're both available on Amazon as well. And honestly, you know, just going through these will just help the way in which we're all thinking about life, really, and we can definitely help our well-being. So Cecil, are you there?
I am, yes. Thank you so much.
No worries. So if you could go ahead and perhaps put your details, you can privately message
Alert
them.
from system UI server. Low battery.
Apologies, I need to...
Alert from low battery.
I do apologize for that. I'm just gonna put my charger in. But yeah, if you can go ahead and send your details to Gary privately, then we'll get these books sent out to you. Congratulations.
Thank you. And I just wanted to say thank you for the talk. It's not the first time I've listened to you speak. It's very constructive as well as inspirational. I really enjoy the way you actually deliver a message. It's really good.
Thank you so much. That's very kind. Thank you. Appreciate that.
You're welcome.
Okay, excellent. So thank you very much for that. I know time has left us this evening. So unless there are any other comments, observations, we again, in the chat, you've got our mobile number, email, and other contact details. So please do get in contact with us, or if you could put a note on the chat, then that would be really helpful to us to see how we are looking. Are there any other things you want us to try and focus on? And all being well, we will either see you next Wednesday at the start of this Bereavement Network sessions, our 6 weeks of sessions starting next Wednesday, and next Thursday for these 9 weeks of completely free of charge fitness sessions. So we'd just like to wish you all a good night. Thank you once again for joining us this evening, and hopefully we will see you all very soon. So good night to you all.
Thank you. Good night.
Thank you. Good night.
Bye.
Night.
Bye.
Good night.
Thank you so much. Good night.
No worries. See you all soon. Good night, Mark. Good night, Kelly.
Bye. Good night.